and our youth should be made aware of this. Millions of young women have been vaccinated for cervical cancer. The FDA approved vaccines initially for cervical cancer, so expanding indications was very, very difficult. But what we really need is we need herd immunity. We need men, women, young girls, young boys to be vaccinated in a herd immunity fashion, and with that, there's the ability to eradicate this disease. Right now, the National Advisory Committee on Immunization recommends boys and girls 11 and 12 years old become vaccinated. And it's because of these two cancers, cervical and oropharyngeal cancer. It's done at that age because that's the age that we think is prior to sexual activity. However, ages 13 to 26 also are recommended, and if you look below, even adults are recommended. Remember, HPV infection is not synonymous with cancer development, and it is correlated with the number of lifetime sexual partners. So we're even advocating that Gardasil be approved for boys and young men up to the age of 26, and even in adults 27 to 45. So if you are a middle-aged adult with a limited number of partners, you still qualify for the vaccine for herd immunity. If you are a younger teenager, young adult, we strongly advocate for it. The more people get vaccinated within a few decades, this talking point and the discussion of all these treatment options won't be necessary because we will have hopefully eradicated this disease. Pap smears available, anal swabs available for cervical and anal cancer. We don't have a test. So if we don't have a test, let's please try to prevent. We now have Gardasil vaccine that protects against 9 versions of HPV, many of the oncogenic forms that are here, and 2 of the benign strains. It's available for children and young adults. If you have questions, please ask your doctor. So last poll question, and I think we're going to wrap up.
All right, so that treatment and prevention, A, Gardasil vaccine protects against OPSCC. B, radiation therapy, preferred treatment. C, oral HPV viral screening tests can predict disease. Or D, HPV OPSCC may imply marital infidelity.
So thank you for paying attention. As all the other questions, the group has been spot on. In the essence of time, last things I'm going to say to you. The ultimate future goals is personalized specific therapy, genomic testing, personalized tumor vaccines, which are currently in development, trying to see can we be more personalized about our treatment, but also vaccination. Because if we can control the virus before it even gets there, then you could have a big impact on this cancer population across the country. Thank you.
All right, Dr. Hackman, thank you so much. This has been a tremendously comprehensive talk. We really appreciate this. We have, I know we're over time, so
apologies.
Oh, no worries. We're glad to have so much information. Just a few quick thank yous. Thank you to the North Carolina General Assembly for their generous support of the University Cancer Research Fund and the UNC Lineberger Comprehensive Cancer Center. Thank you to Mary King, Veneranda Obore, and John Powell for all the hard work they do to make this and every lecture possible. We do have questions, and if you want to ask any questions, we might have time for just one or two. I'm going to just mention our upcoming lectures, and then we'll come back to those questions. We do have an RN and Allied Health lecture coming up on June 12th, helping patients with breast cancer with Catherine Harrell, and then a medical and surgical oncology lecture on June 25th, decision-making in metastatic breast cancer with Dr. Lisa Carey. We hope you'll be able to join us for both of those. We do have new courses that are now in our learning portal. We hope that you'll find them there. And our Cancer Conversations series for the public May 17th, Understanding Skin Cancer Prevention and Treatment. We just had with Dr. David Olilla, but that will be online. And then on June 28th, Medical Marijuana and CBD Oil, What Do We Know, with Amanda Corbett. So we hope you'll be able to join us for those. Thank you for participating. Let's go back and see if we did have any questions come in. Again, I know we went over time, so thank you so much. This has been great.
Thank you.
And we'll put this online, have it in our portal in case anyone would like to view that as an enduring material and take the course there. Until next time.
Have
thank
a
you
wonderful
again.
afternoon.